Hello, welcome to Rational Cannabis, the website that gives you all of the clinical information that you need to know about using medical marijuana. I've worked in the medical marijuana industry for 5 years, independently as a nurse practitioner and in affiliation with physicians as an RN. During this time, I've interviewed and consulted with thousands of patients on their use of marijuana, the effects it's had on them, and how it's impacted their life. These interviews have also included many dispensary owners and product manufacturers who had wealths of information about marijuana use and preparation. In addition to all this clinical work, I've also attended scientific conferences with the top doctors of science and medicine from around the world. I've presented all the latest clinical research on the safety and effective use of marijuana, and also all the advances in physiology and biochemistry associated with studying the subcellular parts of the plant. I've taken all this clinical and scientific information and I've distilled and integrated it in order to create this website to give you comprehensive, useful information to make rational choices about whether to use cannabis or not. On this site, you will find a Chemistry of Cannabis section that describes the interactions of plant components with the human body and how cannabinoids from the plant mimic our own body's chemicals. This mimicking of our own chemicals is why cannabis is non-toxic and no one dies from overdosing on it. These cannabinoids primarily work with the upper hemispheres of our brain, the thinking and reasoning areas, and this is why it doesn't cause severe harm to overdose on it. The opioid drugs, on the other hand, interact with more of the mammalian parts of the brain that regulate our temperature, breathing and respiration, those kind of things. So that's why overdosing on those can actually lead to death, because those are more core parts of our brain. There's lots more detail about all this stuff on the Chemistry of Cannabis page. The How to Use Cannabis page covers the multiple ways to consume cannabis. Smoking has the most history, but there are many ways to safely bring cannabis into your body without smoking it. There's also tips on this page for first-time users and information on the various tools and equipment that you might try out in order to use cannabis. The What to Use Cannabis For page explains the benefits that have the most scientific evidence behind them, and it also covers the most common medical conditions that marijuana has been used for. It also has clinical trials and animal trials and studies on this page as well. The Problems with Cannabis page discusses the variability of cannabis itself. It also lists common and rare side effects, warnings, contraindications, long-term effects, tolerance, drug interactions, overdose information, and possible withdrawal symptoms that could be experienced. The Getting Off of Cannabis page relates to some of these same topics. It discusses the addictive personality trait. It discusses concepts in addiction and alternative theories of addiction, and the kind of things somebody might expect who is a heavy user of cannabis who stops suddenly. The good news, though, is cannabis addiction is roughly the same as coffee. It's not physiologically addictive. Finally, there's a page on how to make your own cannabis products. This is full of useful information on how to make tinctures, topical oils, concentrates, and edibles. It's really good if you live in a state that doesn't have dispensaries. It's also good information for people who just like to do things on their own. So please take the time to review the whole website, and this will allow you to make a rational decision on whether cannabis is right or not for you. All the best to you. Take care now.